Greetings, I'm Carmela G. Malabat from the Adventist University of the Philippines, and my research presentation is Transcultural Nursing Competency Experiences of Foreign Students from Selected Higher Education Institutions in the Philippines, which I co-authored with Dr. Fred B. Ruiz from the Our Lady of Fatima University. The need for transcultural nursing competency experiences among students is of paramount importance. Nursing programs carry the responsibility to adequately prepare students in the provision of culturally competent care. In the Bureau of Immigration, an increase in the influx of foreign students from 2016 to 2017 was from 95,007 to 106,036. In addition, there were 15,765 foreign students who were given study visas. The question is, are these foreigners and students culturally competent in their classroom and clinical experiences during their course of studies here in the Philippines? Professional careers like nursing, the education on culturally appropriate and competent care practices is seldom experienced by students. Studies show that international education can be effective in the transition and adaptation to another culture. Nurse educators should integrate professional values and behaviors in the experiential encounters of students. This study aims to assess the transcultural nursing competency experiences of foreign nursing students as outcomes of curriculum and education. A descriptive qualitative research design was used. Purposive sampling was used based on the following criteria: second, third, and fourth year foreign nursing students exposed to the clinical area, foreign and not permanent residents of the Philippines, and were currently enrolled during 2018. The aid memoir, which is a semi-structured interview, was used as a tool. Ethical considerations on the use of consent form and principles of autonomy, beneficence, and confidentiality were observed. Data gathering was done through interviews, audio recordings, and observations. Saturation was achieved with the six key informants. Data analysis was done using Collici method. Three themes surface. First, transformational acculturation. These are the highlights on what changed the students upon their school entrance. Enhancement of a nurse's cultural competency is through being thoughtful and mindful of the many cultural aspects that may impact the behaviors of people. Transcultural nursing is based on different types of cultures. It is a way of understanding. It is a mind opener. The experience has deepened their understanding with regards to viewpoints coming from all sides of the world. It also brings about a vast understanding on certain diseases, healing, and how people's way of life affects health. Transcultural competencies have made me appreciate cultural differences. It is involving, encompassing, or extending across cultures. Teachers show us that though we have differences, we can still be the same in caring for our patients. Second, transitional acculturation. This is the continuity of learning from classroom to clinical with the following responses. What we learn in the classroom is seen in the clinical setting. When they show us in the classroom, then we learn fast. What is seen and done in the classroom and in the clinical area are compared. Cultural competence, a lifelong learning process, is a key player in the development of better experiences. Day to day, classes are so educative, and I learn a new thing each day. Clinical exposure has made me think out of the box, attending to different patients and encountering different new cases. My expectation is to know and apply, to understand more. I keep on praying harder so God can help me through. One thing I learned is that Filipinos are very resourceful. They will find ways to make things work. They do everything that they can in order to keep the patient safe. Third, transpersonal acculturation, where there is involvement beyond their sense of self, pointing to sublime experiences in nursing education. There is the intertwining of cultural diversity and cultural competence, where there is growth of students' experiential learning. In the clinical setting, one of the good things experienced by the key informants was how they were guided by their clinical instructors. They take us to procedures, meaning they walk us through it. Clinical supervision is an effective way of helping students to adjust to a new environment. They're always around us and they keep demonstrating on how to do it. Everyday classes are new days of learning skills or lecture and new experiences. Different cultural and academic background can show a different level of assertiveness. This contributes to more understanding and give a different perspective of another culture. The experiences of the key informants did not only help them in personally knowing, but in personally understanding themselves and others. I got to know about the different cultures. I try my best to understand. I try to behave like them to humble myself. Personal adaptation is personal knowing, adopting, and embracing the meaning of spirituality. We had to pray so that the Lord our God can help us through. If we do not know what to do, we can ask them. This helped us to learn more skills. They first start with devotionals and they relate it to the current topic that we are studying about. Cultural encounters ensue when nurses engage in cross-cultural interactions. Since every client possesses an exceptional experience on health and affliction, all encounters amongst clients and nurses are multicultural encounters. In conclusion, this triad of transcultural adaptation of dynamic and unending lifelong learning experiences in both settings transcend to the goal of providing culturally competent quality nursing care. Recommendations: Number one, strengthen and improve students' classroom and clinical experiences by incorporating transcultural nursing in the curriculum. Number two, the study could be replicated in other institutions to get a wider scope of data. And likewise, respondents coming from other allied health professions can also be included. And that concludes my presentation. Thank you. Mabuhay po kayong lahat.